We spoke a little bit earlier in the show, Minister, to Phil Hay of the INMO and Conor Deasy, a consultant in emergency medicine in CUH, just about staffing shortages. They both talked about how close that hospital and other hospitals in the system are to becoming overrun and to the cancellation of elective procedures. What is your assessment of how close we are to that point?
We are pretty close. So if we look at ICU, we've got 65 COVID patients in critical care at the moment. There's 55 ICU beds available. As you said, we are now cancelling elective care, both inpatient and outpatient care, and that patients are going to be notified through the week that that is the case. We're doing that to reduce footfall and to increase capacity, both in the wards and in critical care. We're already working on the ground with the private hospitals as well, and more formal arrangements should be put in place this week. But the situation is serious, and it's one of the reasons that I'm very happy to see that as of this morning, we've increased our vaccination targets for this week considerably. So, as you know, last Friday I announced that we'd moved up to a target of 20,000 vaccinations for this week, starting today. As of this morning, we got the latest Pfizer delivery. We got it 2 days early. So we've moved up from a target of 20,000 this week to 35,000 this week. Now, that's nursing homes, obviously, both residents and staff. But critically to your question on healthcare, we're doing a big push in the hospitals. So it'll be frontline healthcare workers in the hospitals. And we're also doing a big push in community. So from the hospitals, we'll be vaccinating frontline community healthcare workers. And one of the things I'm talking with the HSC with today, and that I know they're very keen to have in place, is that included in that this week is we begin vaccinating GPs as well.
So that GPs then can begin to play a role in the vaccine programme itself?
Partly that, absolutely, yeah. We'll want our GPs and our pharmacists heavily involved in the vaccination programme. The big game changer there, I believe, will be the AstraZeneca vaccine. So that's been authorised in the UK, as you know. The great advantage of the AstraZeneca vaccine, unlike the first two, Pfizer and Moderna, which have to be kept at minus 70 and minus 20, AstraZeneca can be kept at a refrigerated temperature, making it much easier to send it out.
Yeah, and they're getting it today. A woman, Eileen Lynch, got it in Northern Ireland today, 96-year-old. I think she's 96. I hope I haven't done her a disservice there. Anyway, she's got it in Northern Ireland today. She's delighted with it. There's going to be a bit of a delay before there'll be jabs in the arm here for the Oxford AstraZeneca. There has been criticism of European authorities on this, that they're moving a little too slowly in terms of approval.
So, we're tied into the European Medicines Agency, obviously.
Would you like to see them move quicker?
Gosh, I think I'm sure they'd like to see it move quicker. In fairness to them, their original date for Pfizer was the 29th of December. They then moved that forward by a week. And my understanding is there's going to be a decision on Moderna this week, in the next days.
So Oxford AstraZeneca, we might get it a little sooner than we expect?
Well, I hope so. We don't have it yet. We don't have a confirmed date, but we are very aware that the UK has authorised it. We will stick, obviously, with our own regulator. But if and when that is authorised, I think that opens up the GP and pharmacist network in a big way. There are a few things we have to protect that warrant doing things as difficult as moving to level 5 and everything that comes with that, and the huge pain and cost and suffering that comes with that. So what have we been doing? We've been, first and foremost, protecting life, because as we know, there has been, unfortunately, a high fatality rate with this. Secondly, we're protecting the healthcare system. Thirdly, we're looking to keep the schools and third level open, and obviously to protect jobs as well. This all has to be worked through. It's early days, but my view is that once you vaccinate and protect people who could die from this, and you protect our frontline healthcare workers and, let's say, our teachers and some of the other groups, then I think we need to start having a serious conversation and saying, well, look, the risk profile now is reduced. And so can we afford essentially to have a higher level of cases in the community?
Yeah.
Right. And that's obviously a conversation that the public health teams need to look at very, very closely. But the priorities, as always, protect life, protect the healthcare systems, which of course ultimately is to protect life as well, protect education, protect jobs.